Good afternoon, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to a fourth edition of Not Just a Dog, honoring hope in healing, recognizing the caregivers to celebrate National Doctors' Day. And to celebrate this day, today I have with us Dr. Ranjan Modi, a cardiologist from Sarvodaya Healthcare, Faridabad. Welcome to our show, sir.
Thank you so much. Thank you so much. It's good to be on the show.
Thank you so much, sir, and congratulations and all the best wishes to you on National Doctors' Day.
Oh, thank you so much. It's one day which we are really proud of. So yes.
So we are proud of our doctors and to all the days in a year we have. So it's just a one day to show that gratitude, but we celebrate and we like to honor all the doctors every day in a year. And to celebrate this fourth edition of Not Just a Dog, which sets an extraordinary celebration dedicated to showcasing the remarkable efforts of our doctors and expressing our heartfelt appreciation for their selfless service. This edition aims to celebrate a doctor beyond their profession, to highlight their liking, their disliking, their own personal life beyond their profession. So, I would like to know from you, sir, what inspired you to pursue a career in medicine and how do you balance your personal and professional life?
What inspired me? I think I have a family of doctors. My parents are both doctors. My grandparents were both doctors. So I think that was the only thing I ever saw in my life. So I think it was a very obvious kind of a thing that I ended up being in the same fraternity as my parents and everyone else. But I think the inspiration was always yes that it was happy to see my parents feeling good about something they've done well, which helped the patient get out of pain or help the patient survive longer. So that kind of passion was always seen in my family, and I think that inspired me a lot. That it's one of the easiest thing you can do to help someone. If you can't keep them healthy, then there's nothing else in life. So if a patient walks into you and they have some problems, and you can then send them back on medications or with some procedures, and they come back smiling the next time that they see you, that's the best feeling you can get. So I think that's what's inspired all our doctors, most of them. Though it's a tough job in India, but yes, it's rewarding once they come back and you see them smiling.
You said it right, sir. It is a tough job and you need to have a balance of, keep your mind cool and be working on to how you can help patients, a patient. So how do you balance your personal and professional life?
Uh, Balance of professional personal life is, I think it's a lot dependent on a doctor as well. Um, you got to have, once you enter the hospital, you are people's person. You need to make sure that, you are able to deliver everything a patient can ask you to do. But outside the hospital, you need to have your own time. You have to enjoy your own self. I think doctor in India is a very stressful job. We are all stressed because of the number of patients we see, the kind of uh, god-like thing people have for doctors, which is untrue. But they assume that once you're to a doctor, they will make sure that you're fine, which is sometimes not true, because there are some things out of our hands. But that's a lot of stress. It's like putting 150 crore billion people on Virat Kohli stress of making sure that he plays every time. That doesn't happen. The doctors face the same thing. So I think we doctors need to make sure that we keep our hobbies on. We all have hobbies. We need to go back. We enjoy music. We enjoy movies. We enjoy uh, uh, painting. We enjoy hanging out with our friends. So I think those helps a lot. Once our hobbies are there, then we are able to de-stress ourselves. We're able to get out. We can play sports. Like we love playing sports and music every day. So I love doing that. So if that's the best de-stress I can, so that brings a balance between your personal and your professional life. And then once you are de-stressed, it becomes easier for you to come back the next day with the same vibe and with the same enthusiasm to treat the rest of the patients.
That's great, sir. And I think you have told every doctor out there how they can keep a balance, although everyone has their own way to do it. But yes, we have another way to do that.
Exactly. But I think it's very important now. Doctors, we in our profession, professionals like lawyers and doctors, they need to keep that enthusiasm going on. And the only way you can do that is once you're able to get out of that system for a few hours, once you're back home, and then get into back the system. Otherwise, you're just stuck there.
So, what hobby you pursue outside your medical practice? What that
So,
keeps you, engaging and de-stress?
okay, most of us. So here's a fact. Most of the doctors end up having no hobbies because the only thing you're doing for almost 20 to 25 of your years is just looking at those books, looking at patients. And so that kind of becomes your hobby. So for my parents, their hobby is nothing but seeing patients is their hobby. So it becomes a part of our life. But yes, I think with the newer generations, we are trying to change that. I love playing in the. I try and make it a point that I go for sports almost for 3 to 4 times in a week. Love reading off and on whenever I can get time. Not reading medical books, but yes, some fiction. Music is always a passion. So, and then family. I think family provides you the best possible de-stressor in life. Once you go back and you have an entire house sitting around and having a chit chat and then enjoying life, that I think those get outs, take offs like once a month, take a 2 days weekend off, a staycation somewhere. That actually helps people a lot. So I think that's the best thing you can do. So I think those hobbies are the best you can enjoy, sir. But that, as you said, it's very personalized. People need to find their own ways of de-stressing themselves. So I think each one to itself.
Yes, sir. And so, that advice you would like to give to your fellow doctors, those who are pursuing this passion of medicine. So, how can they pursue their passion outside this profession if they have to?
See, I personally feel that you're the best when you are completely thinking straight. And for thinking straight and keeping your mind clear, you need to, as we said, de-stress yourself. So always, never be. I would rather say never be unhappy or feel sad to say that you're tired. Uh, you can stretch yourself, but if your health allows, then only you'll be able to treat your patients. So one, stay healthy. Second, always remember your patients are your priority. Till the time your patients are happy, everything you're doing in life is good. So you're married to the patient, you're not married to anything else. So make sure your patient remains your priority, irrespective of anything in the world. Enjoy yourself, have fun, have the passion to get up early in the morning and run to the hospital. If you're not going to enjoy your profession, then nothing is going to work. So I think younger people just have fun, have, have, have the zeal to get up and work to whatever you aim for. And what you need to aim for is the patients getting fine in their health. That's it.
That's great, sir. And so, my last question would be to what do you enjoy most about interacting with your patients on a personal level, and how does this enhance your medical practice?
I think when a patient is able to tell you everything very clearly, I think two people are there, two professions where you need to just be very clear. Lawyers and doctors are one thing, you should just bring out everything. If a patient can come and tell you, you know what, yes, I did a mistake, you told me this, I didn't do this, at least he has a belief in you. Once they start believing you, my half practice is done once the patient has a faith in me. So if I can make the patient understand why are we doing this, why are you suffering from this, and how this will help you in controlling these problems, then everything remains fine. So the only thing which matters to us is if the patient is able to understand what's happening to him, patient is able to understand how we can cure them, and if the patient has faith. My 90% of my job is done if the patient believes in me. If he believes I can cure him, my job is 90% done. 10% is medication. So need to sit down. Communication is very important with every patient. So communication, patient comes to us, talks about us, talks not only about his disease but his life. It's good enough for us. So that kind of communication is important when they can talk about anything from their family to their life to their diseases, everything actually.
That trust matters a lot. When a patient have that trust with the doctors, and doctors know that the patient is trusting him, then I
Yes.
believe what you said, the most of the work is done and rest of the medicines will do.
Yes, if it's done See, we doctors need to realize we need to spend time with the patient. You can't just
Yeah.
have the patient get in, ask him, okay, write two medications, send him back. We need to sit down and listen to him. Once you're able to listen to him, half your work is already done, and the patient will always trust you then.
That's great, sir. And that's a great piece of thing, advice, or the way you deal with your patients have just explained to us, to our audience. And that's why we celebrate doctors. That's why we are, we honor doctors. The personalized level, the personally they are involved with the patients. How much time do they contribute? How much they are into, the focus they are to treat their patients. The thing that they have to build that trust with them, that is great and that is awesome. That's why doctors are there to treat patients. And thank you so much for being there. Thank you so much on coming to this platform.
Thank you so much. Thank you so much for inviting us.